In scenario 3, all of the procedures required to bringing the patient in will have been done in scenario 2. Therefore, we will only be examining how we will prepare for an aerosol generating procedure. In an aerosol generating procedure, we require 3 doctors. 1 and 2 will be in the clinical room with the patient, and number 3 will be standing outside. In scenario 3, for an AGP, you will need a full PPE. That entails getting an N95 mask, a face shield, a blue impermeable gown, gloves, as well as a head cover, which is optional. In order to get an N95 mask, you must first fill out the form necessary for it. Once you have filled out this form, you will give it to Fabiola to sign and then take it down to AS 175. Only 1 mask can be given per person. Once you have your N95 mask, then you can proceed to the room A3230 for the donning procedure. All donning procedures begin with the participant washing their hands. Make sure to wash thoroughly your fingers, in between your fingers, as well as the palms of your hands. Once you have finished washing your hands, then you can proceed with putting on the gown. Now, normally this is all done with a buddy so that someone can be observing you and making sure that all the steps that are necessary have been done. Once the blue gown is put on and is properly sealed, then we can proceed with putting on the N95 mask. The N95 mask should be placed in the palm of one's hand and cupped, and then placed on your face. The superior elastic should be placed right above where the hair has been tied, making sure that always tying your hair midway on your head. Then, following that, the lower elastic should be placed right around the nape of the neck. Once the mask has been positioned, then the nose and the areas of the nose have to be adjusted and tightened. One should not pinch, as air escape might occur at the top of the mask. Once the mask has been positioned, do the air escape exercise where you verify if there's any air escaping from any sides of the mask. If the mask feels well sealed, then you can proceed to putting on protective eyewear. Normally we would have a face shield with a headband, or also goggles can be used in this scenario. Following that, the optional head cap can be donned. And finally, the gloves. Always making sure that your gloves cover the cuffs of your gown. When we are here, we will then enter room A3229, where we will take all of the instruments that are necessary for the AGP procedure. Dr. 1 and Dr. 2 will then enter the SAS thanks to the help of Dr. number 3. Dr. number 3 should be always wearing a mask and gloves to help with procedures. Once the procedure has been completed, all instruments should be collected and put back on the tray. Dr. 1 can then take the tray with all the instruments and exit the room. Dr. 2, in the meantime, will request that the patient wash their hands. Once Dr. 1 brings the tray over to the dirty table, proceeds to taking all of the dirty instruments and putting them into the disposable solution where they will be treated, and all other 2x2s and all other disposable materials shall be taken and discarded into the biohazard bin. Once those 2 steps are completed, then the docking procedure can begin.
As with scenario 2, make sure once the patient has washed their hands that the door remains closed so that the aerosols settle inside the room. The patient will then wait. Doctor number 3 will hand a clean mask to the patient. The patient will then wear the clean mask, and doctor number 3 will then take the patient and escort them out.
Once we are prepared to do the docking procedure, you must remember that you need to wash your hands between each step. To begin the doffing procedure, we recommend that you remove your glasses first. When you are cleaning your goggles, you must make sure to use a wipe and thoroughly wipe your goggles. Once you have wiped your goggles, you should wipe your gloves and proceed to doing this step 2 additional times for a total of 3 times. Once this step has been completed, you may proceed to removing your gloves. Begin with one hand by pinching the glove and rolling it over. Then use your finger to remove the other glove. You may also use the process where you have still your gloves on and you can rip off your gown. Always make sure to try to remove your gown by touching the internal part and from the flute. You must wash your hands between each step after removing the gown and after removing the gloves. In this final step, you may remove your headrest, again making sure not to touch your head and removing it forward. Once you have completed all these steps, you then may go into the washroom and to proceed to properly wash your hands with water and soap. Once the doffing procedure has been completed, then you may exit the SAS area with the help of Dr. Number 3 with your mask N95 mask still on. Then you must enter A3229 yet again and remove your mask, your N95 mask, in this room. Always remembering that you must always wash your hands after every step. To proceed of the removal of the N95 mask, you will begin by reaching behind your head and removing the elastic around the neck, always providing a bit of strain. Then remove the elastic on the top of the head and bring the mask forward and throw it away. Once that step has been completed, then you can, again, there will be a dispenser where you can wash your hands and make sure to also include your wrists. At this point, your scrubs are now also potentially contaminated. Therefore, it is required after an AGP to change your scrubs. So you must remove the existing scrubs that you have on, take a new pair of scrubs from here, and don on the new scrubs. The old scrubs will be discarded in this bin.